I hope everybody can hear me. Today I am going to be doing my project on lupus. So what exactly is lupus? It's a type of autoimmune disorder that targets many organs, including the skin in the form of a rash, kidneys, muscles, and joints. There's a lot of discomfort in this, especially with people who deal with more of the joints issues. It's super uncomfortable, and they have to live day to day with this. The word autoimmune basically means disorder in which body destroys healthy tissues, cells, and organs by mistake. So this is kind of a deficiency where these antibodies that we're creating for ourselves are being attacked by autoantibodies. Women are 90% more likely than men to get lupus. Here I added a diagram on the left of how that works. And these symptoms typically arise in what we call flare-ups, which are basically just like a periodic part of time where these symptoms occur all at once. There are a few types of lupus. The most famous ones are SLE, the most common, lupus cutaneous, which affects the skin, lupus nephritis, which affects the kidneys, and drug-induced lupus, medications that spark someone into lupus due to immune response. Some symptoms are included are fatigue, feeling sleepy constantly, basically just tired all throughout the entire day. Kidney problems. Kidneys are obviously responsible for filtrating blood and producing urine in the body. So they cannot do this when they have high inflammation levels. The butterfly rash, which is typically known for affecting people with this disease specifically. You don't see that with any other disease. And of course, joint pain. So inflammation in the joints causing swelling and stiffness. Swollen hands or feet. On the right here, you're going to see that the middle part of his fingers are almost bulged out. It's obviously not normal. This happens due to fluid spilling out of the tissues. So fluid inside of your joint spills out into the tissues and makes your fingers swell. And then another symptoms you may see is hives. So typically you're going to only see this like in an allergy. But lupus somehow does ha have this as a symptom. So etiology, what are the causes? Technically, at this point, there is no cause or nothing specific that they can point to that says this is what causes it. So they basically just throw it into these three categories. We have genetics, so obviously you're more likely to develop an autoimmune disease if it's in your family history, regardless of what it is. Just the fact that autoimmunity exists in the family um, makes you more at risk. Environmental, so things like exposure to sunlight, high levels of stress. Sorry about that. High levels of stress, or things that can be harmful to your body, such as smoking and medications, can cause a lupus flare-up. If your immune system cannot repair damaged cells, it's likely to mark them foreign and attack them. So pathophysiology of lupus. So pathophysiology basically means the course that this disease takes in order to become a little bit worse or possibly get a little bit better. So immune system dysfunction, the immune system mistakenly identifies the body's healthy tissues as threats. Body produces autoantibodies that target DNA. These autoantibodies are basically just like the attacker of the immune system that start an immune response. Genetic and environmental factors are obviously involved in that. Change in one's environmental, whether physical or chemical, can trigger an immune response to those who are predisposed. Obviously, I also put triggers create immune response, which causes an overproduction of autoantibodies and cytokines, which basically are inflammatory markers, and chronic inflammation leads to tissue damage. And on the right here is a diagram of how exactly that works. So the diagnosis relies heavily on blood tests that test for these autoantibodies, inflammation markers, and organ involvement. Blood tests typically drawn to determine the diagnosis include an ANA screen, which checks for these autoantibodies and attack the nucleus. 90% positive in these patients. Typically, 90% of people who have lupus mark positive for this. ESR and CRP are inflammation markers. So if these are high, that's another indication that there could be some form of autoimmune disorder going on. Um, Anti-DNA antibodies detect antibodies against double-stranded DNA. We have a CMP, which is a regular test that they do basically for anything. It's a series of 14 tests that check your kidney and liver function, along with many other things such as hydration levels, like your electrolytes, glucose levels, and hematocrit levels. And then we have anti-Smith antibodies, which are highly specific in lupus patients, meaning that if you test positive for this, there's a very good chance that you have lupus. And I've actually put a diagram here to the right to kind of show you guys. Let me move this out of the way. Exactly what I'm talking about. So all of the reference ranges are going to be over here. So differential diagnoses are basically what this can be mistaken as upon diagnosis. There are very limited amounts of diagnoses that this could be just because it is so specific to those autoantibodies, but ones that physically look like this are rheumatoid arthritis, so another form of autoimmune disorder which has similar joint inflammation. Your CRP is going to be elevated, your ESR is going to be elevated, and you will have pain. However, the diagnosis for rheumatoid arthritis requires a test that is called rheumatoid factor that needs to be positive in order for you to be diagnosed with RA. And then we have Sjogren's syndrome, which is another form of autoimmune disease that targets the moisture producing glands, such as your salivary and your lacrimal. Similar symptoms, including fatigue and joint pain, but also test for different antibodies. One way to identify somebody that has this will 100% be that they will have a butterfly rash that I mentioned earlier. This is very specific to these patients, and about 50% of them have it. Oh, come on. Treatment is so technically there's no actual cure. They haven't been working on one obviously, but it's just not popped out yet. The initial treatment is going to be NSAIDs for pain, so non-steroidal anti-inflammatory drugs, or they will prescribe small doses of corticosteroids such as prednisone to control flare-up. You want to keep the flare-ups down to keep the inflammation down so they don't affect the kidneys and the other organs of the body. For long-term care, you can start an immunosuppressant drug such as methotrexate or hydroxychloroquine, which is basically an anti-malaria drug. Risk of the treatment, you're going to lose your hair possibly with the immunosuppressant drugs. You may develop Cushing syndromes from corticosteroids. On the right here, you can see this lady's got a little bit of a more round face than she normally did. And that is due to the high amounts of glucose and cortisol in her body, as well as weight gain and obviously weakened immunity because of these immunosuppressants. Prognosis, so a mild form, typically manageable with medication and lifestyle change. Normal life expectancy, medication mildly effective in this stage. You're not going to feel the best. I'll get to that later in this slide as to how even with medication, it's still you'll still experience some symptoms. Severe forms, those are the ones that you want to avoid. So they do the damage to the major kidneys of the body, such as the skin, kidneys, and respiratory system. Medication is basically not effective at all in this stage. Early detection can prevent major organ damage, and as well as flare-up management by avoiding triggers can help avoid complications. So stay away from the sun, stop the medications that may be causing it, and try to limit stress. The quality of life. So this can expect a full life expectancy for the patient if managed properly and can even have inactive phases. So basically, they can go into a small form of remission where it goes away and then returns at some point in their life, whether that be from stress or whatever they have going on. Regardless of whether or not you have medication management or you're in a severe form of lupus, you will experience fatigue and sun sensitivity even more than you ever have. And that is my citations page. So I have reached the end of my PowerPoint. Thank you for listening.